Good day, everyone, and welcome back to our training on Advanced Basic Life Support for Advanced Nurses and Midwives. In this video, we will be talking about airway and breathing management. But before we proceed, let's quickly review our previous lesson. In our previous lesson, we demonstrated the compressions at 100 to 120 per minute and 5 to 6 centimeters depth for adults. We also taught about how to maintain full recoil and limit interruptions to under 10 seconds. And finally, we identified and corrected common compression errors and demonstrated safe team rotation for every 2 minutes. Now back to our topic. By the end of this module, participants will be able to identify causes and signs of airway obstruction in an unconscious patient, demonstrate head tilt chin lift and jaw thrust appropriately. Now, let's get started with seeing why airway and breathing management is important in basic life support. Airway and breathing management are essential parts of basic life support because oxygen must reach the lungs before it can be carried in the blood to the brain, heart, and other organs. In simple terms, even if chest compressions are being done well, the body still needs oxygen. If the airway is blocked or the lungs are not being ventilated, oxygen levels will continue to fall. Failure to maintain an open airway is a major cause of poor outcome in unconscious patients and cardiac arrest. Brain cells begin to die within about 3 to 5 minutes of severe oxygen deprivation. This is why airway opening and effective breathing support must happen quickly and correctly. Airway and breathing management help to keep the airway open, allow rescue breaths to enter the lungs, reduce the chance of hypoxia, support effective CPR, improve the chance of recovery. Note: a blocked airway can make all other resuscitation efforts less effective. Now, we will look at the parts of the airway involved and how does obstruction happen. The upper airway includes the nose, the mouth, the pharynx, and the larynx. In an unconscious person, the muscles of the tongue and throat relax. This allows the tongue to fall backward and block the airway. This is the most common cause of airway obstruction in an unconscious adult. Airway obstruction happens when air cannot move freely in or out of the lungs. Other causes of obstruction may include foreign bodies, vomit, secretions, blood, swelling, trauma to the face or airway. Important signs of obstruction may include no effective breathing, snoring sounds, gurgling sounds, choking signs, no chest rise, difficulty moving air. Note: in unconscious patients, the tongue is often the first thing to suspect as the cause of airway blockage. Next is how the airway is opened in a non-trauma patient. The standard method for opening the airway in a non-trauma patient is the head tilt chin lift technique. This method works by moving the tongue away from the back of the throat and creating a clearer path for air to enter the lungs. This maneuver opens the airway by lifting the tongue away from the back of the throat. To perform head tilt chin lift, place one hand on the forehead. Apply gentle backward pressure to tilt the head. Place the fingers of the other hand under the bony part of the chin. Lift the chin upward. Do not press into the soft tissues under the chin because that may worsen airway obstruction. Note: head tilt chin lift is the preferred method when trauma is not suspected. In summary, airway and breathing are critical for survival because oxygen must reach the lungs and brain quickly. Without it, brain damage can begin within minutes. Also, Airway obstruction is common in unconscious patients. The tongue falling backward is the most frequent cause. Recognize signs like snoring, gurgling, or no chest rise. Furthermore, proper techniques restore airflow and support CPR. Use head tilt chin lift or jaw thrust, assess breathing within 10 seconds, and provide effective rescue breaths with visible chest rise. That is it for this session. Thanks for watching. See you in our next session.